Hi, Larry.
How you doing?
Thanks for coming in and agreeing to tell us a little bit about your story today. So, how long ago did you come into our office?
This time about almost 3 weeks.
3 weeks. But it's been a long time since you've been in here before that. Years.
It's been a few years.
Yeah. So, what brought you in here in the first place?
Well, actually, I was talking to my brother on the phone. It didn't enter my mind to come to a chiropractor. My brother and I were talking on the phone, and he asked me if I knew a good chiropractor. I said, yeah, there was somebody I was seeing for quite a long time. Because I'd tried everything else. I injured my back in, was 04. Original injury, then re-injured it. The big injury was 06.
And you did that at work, right?
It was work related.
And what were you doing?
I'm an ICU nurse. Actually, I was going around the bed to put the patient back on a ventilator, and the day before we had put the patient on one of those Clinitron beds to prevent bed sores.
Okay.
Well, it pulsates sand. Well, the sand is so fine you can't see it, and it had been pulsating for 19 hours. And I come to work at 7 o'clock in the morning, and the patient came off the ventilator. So I went into the room to put the patient back on the ventilator, and I turned that corner, and I mean it was like a Laurel and Hardy cartoon.
You hit the sand.
My legs were up. I grabbed the TV, but it was a rolling TV. On a stand. I grabbed the bed, and the TV that went that way, my arm went that way, my back went this way. It was just unbelievable the position I was in, and that was it. That was the end of it.
And that was in 07, you said? Or?
That was in 06.
06. Okay.
And I haven't been back to work since.
Oh, right.
I have not been back to work since.
Right.
I did.
So you've seen doctors, obviously, for it over the years.
I've seen orthopedic surgeons, and I'm currently now seeing a neurologist. Continue to see a neurologist. I get epidural injections in my neck and back between 3 and 4 times a year.
Okay.
Because I have so many discs involved in it, in my cervical area and my lumbar area, they said that if it came to the point where they could do it, they would want to infuse my whole back.
Oh yeah, that doesn't sound fun.
No, and I didn't want to walk around like a
plank. Yeah.
Yeah. So over the years, the epidural injections helped the overall pain and given me some range of motion.
Right.
Well, about 3 months ago, I had started riding my bike, and I noticed on certain days my area in my back right here would flare up, and then after about 24 hours, it would go away. Well, I started building up distances, and the more distance I went, the more periods of this area back there where it started flaring up really bad. And then I started getting the tingling, the pinching sensation, and my toes went numb.
Right.
And then it went out. I mean, that's the only way I can explain it. It was constantly pitching. Pain, constant pain. It was 24/7. There was no way for me to get rid of it, and cried.
Did you go to the doctor for that?
Oh yeah.
And what they
said? And actually, we tried a couple of things. We did. They did a hip injection. They immediately got me in and did the epidural. They gave me pinpoint injections, and
that didn't help.
Nothing helped. I mean, literally, nothing that they did was helping. At that point in the time, man, I just couldn't see the light at the end of the tunnel.
Right.
I was destitute at that time.
So you're talking to your brother, and he's the one that suggested...
He says, I go to a chiropractor, I believe in it all the time. He says, you used to go to a chiropractor, tell me how well he made you feel. He says, so I said, okay, I'll try it. That's when I came to see you about 3 weeks, and my life has changed.
In 3 weeks?
In 3 weeks, my life has changed.
So
the periods of the pinching sensation are all, knock on wood, boy, are all but gone.
Okay.
I'm getting longer and longer periods now where I don't get that pinching sensation.
Right.
Overall pain is 100%.
Yeah.
100% better.
Huh.
My whole attitude of life has changed. I can actually smile now.
Yeah.
I'm not thinking of how miserable I am 24/7.
Yeah. One of our mottos is, that we provide life-changing care, and it's like stories like that. Yeah.
Man, it has changed my life in a matter of 3 weeks, and literally after the first visit. my right shoulder, which was
is
involved.
something you didn't even come in involved,
That
right?
was not one of the major reasons I came in. And I mean, after the first treatment, I almost had a full range of motion.
And how long has that been going on since?
Oh geez, that thing's been going on for years.
Yeah, you kind of given up on that, right?
Well, yeah. Well, I literally couldn't do this. I could not wash this portion of my back.
right.
I couldn't wash this portion of my back. As you can see now,
Right.
I'm making this motion.
Very good.
I couldn't do this. I could not do that. The highest I get up was about here. Literally, range of motion in my neck. Even though the epidural injections, they give me a much better range of motion.
Right.
I could not turn my head like this.
Right.
That was an impossibility.
Right.
And you found something out that, I mean, nobody else has found out about my neck.
Right. The dish or
It's all fused in
yeah,
here.
Yeah.
And
that's kind of amazing. I mean, they've taken so many films of it. Nobody's ever told you that. So.
You're the first person that's ever told, and that explains so much about, sometimes I have a hard time swallowing, and sometimes I'll just be sitting there, and it's almost like I'm aspirating.
Right.
And it kind of explains it because it's positional.
Yeah. Well, you got all that extra calcium laying in there, and it's going to compromise the throat, basically. Yeah.
Exactly. But I just can't speak enough about it.
So, and you like their care here, the staff, and all that.
Everybody has been fantastic.
That's great.
And all the massage people that I've had, now that I've had 3 of them, and I'm sure they're all I call them, they have magic hands. And I didn't know that hurt could feel so good.
Yeah.
Because when they're doing it, when they hit the
That's
hot
not
spots, there's no getting about it. But boy, when I'm done, I don't want to get off the table.
So that's great. What would you tell somebody that's thinking about coming in?
Absolutely, 100%. I couldn't speak enough for the staff here and the treatment that I'm getting.
Great. I appreciate that. Thanks for taking some time this morning.
No problem. My pleasure.